Alrighty. Good evening, everyone. Thanks for tuning in to JeffCo Health Matters, where we discuss matters of health that matter to our health. My name is Brianne. I'm the Public Communications Officer with the Jefferson County Health Department. And tonight we're actually going to be talking about communicable disease and epidemiology. These topics have kind of seemed maybe over-discussed in the last 15 months because of COVID. However, COVID's only a piece of the work that our CD team does. And communicable disease investigations and epidemiology play a much bigger role in our county's public health, more than most people think. So this evening, I am joined by Sara, our epidemiologist, who you probably recognize from our Stats with Sara segment, and then both of our public health investigative nurses, Tara and Vanessa. So we're just going to go ahead and jump right into some of the topics here this evening. First things first. Let's start with definitions. So what is a communicable disease nurse, and what are your roles in the health department?
I'm Vanessa. So a communicable disease nurse, in a nutshell, we receive lab results on conditions that are considered reportable. Reportable conditions are determined by the CDC. So essentially what happens is physicians, hospitals, labs will send lab results our way. When we get those, we follow a certain set of guidelines to investigate each case. The goal of those investigations is to gain enough information about each individual case that we can develop a better knowledge of what is circulating in our community and how we can prevent that. So again, we're talking about reportable communicable diseases. So each one, as you can imagine, requires a different type of response. So some of those may require a phone call from Tara or myself, your friendly neighborhood CD nurses. If we call you, we promise we won't take too much of your time. Usually the interviews take about 10 minutes. They're totally voluntary, but they really help to give us some insight into possible sources of infection. Then we take that and it's fed into national data. So yeah, that's pretty much what we do.
You say that so nonchalantly. That's a lot, you guys. That's pretty cool. So one of the things too that I wanted to, we kind of chatted before this and we're talking about what we were going to look at. So how do you get that information? How do you know when to call someone or start that investigation? How do we get that?
So first, you have your reportable conditions. That's from the CDC. They decide that it's aimed at preventing illness. So then we have guidelines set by the state. So the labs, the hospitals, the providers, they're the ones sending us the information. We're using the CDC's guidelines and the state's guidelines to determine how we need to follow up with that information. You're muted.
I even said that. I was like, I'll unmute you guys, and then I go unmute myself. Go figure. Okay, so then Sara, what does an epidemiologist do? We kind of get a little bit of a glimpse with the Stats with Sara, but there's a whole lot more that happens there. And then how do you work with Tara and Vanessa?
Yeah, so for those who may not know what epidemiology is, let me start off by explaining that. It's the study of diseases and determinants of health in a specific population. So as an epidemiologist, I'm looking at the distribution of diseases, so the frequency, any patterns, and its causes in our specific community. So the main goal is to help control the spread of disease. Surveillance is a big part of this. So there's a lot of different types of public health surveillance systems, and one of the ones that I use on a daily basis helps me monitor any disease trends in the community and quickly identify any clusters of illness. So to sum it up, myself and our CD nurses were in constant communication because we're all working with the same diseases, but I'm looking at the bigger picture and those large scale patterns, while Tara and Vanessa are looking at more of the details of each individual case.
Perfect. Yeah, I think that's important too, because like people have gotten used to your epidemiology reports, the weekly reports with all of the data and pieces like that. But that's one piece of it, and you collect all of that data. But like you said, the the other parts of this great team are the ones kind of doing that investigative work. And so some people are probably more familiar with what that process looks like just because of COVID, and it's been talked about a lot, as fact that we have case investigations and contact tracing and all of that stuff, but we do that for more than just COVID. So actually, what are the common diseases or communicable diseases that we see in Jefferson County that we would continue to do these kind of case investigations for?
So we see a ton of GI illness and tick-borne illnesses. We monitor other things that come through, but the bulk of what we do, especially in the summertime, it's just constant. E. coli, salmonella, Rocky Mountain spotted fever, Lyme, ehrlichiosis, stuff like that. And then those all require some follow-up.
Yeah, and I'm actually glad that you mentioned that, because we were going to talk about that, but let's just jump into that part right now. Like with the summer and things like that, we know that ticks are especially a concern in the county, as well as with like summer barbecues and stuff. And I didn't know all the stuff about potato salad till I started hanging out with environmental downstairs. And now I'm like, I don't think I want to eat potato salad anymore. So like people leave stuff out, and I'm guilty of it too. Like you just leave stuff out because you're in the pool or whatever. So yeah, what kind of prevention tips do you have for folks, especially on those GI ones?
So there's no shame in sneaking the meat thermometer to the neighbor's barbecue. I'm not going to tell. No shame in that game. So, making sure that food is being cooked and stored appropriately, washing our hands, hand hygiene. So many things come back to hand hygiene. Not only if you're preparing the food, because, wow, you could be touching everyone's food,
Right.
But even, if I get some baby carrots out of here and then the next person comes over and they get some baby carrots out of there, everyone needs to be washing their hands and paying attention to that.
Right.
As far as tick-borne illnesses, we've got a 24-hour window to get those babies off of you. So even if you're in your backyard, you don't have to be camping and at the lake and riding side-by-sides to have a tick somewhere. And the smallest little tiny things that are hard to see can carry some of the meanest things that will make you really ill. So just make sure you're being diligent, especially in these warmer months, about checking yourself. If you have children, check them. If you guys are at the park, when you get back, check yourself for ticks, just making sure that that you're aware of those, you're getting those off. And then, if you feel sick, call your doctor. If you
Right.
feel sick, take care of yourself. We can't personally diagnose and treat you, but go to a provider. They can diagnose and treat you.
Mhm.
If you're diagnosed with a communicable illness of some kind and have questions, call us. We're here to support you and answer any questions you have. But just make sure you're taking care of yourself.
Yeah, keep the bug spray handy. I have bug spray in my car. I have bug spray in my husband's car, like the good stuff too. You got to make sure you're taking care of yourself. So we've talked about some of the communicable diseases, specifically like the GI ones and tick and things like that. But what's the risk of actually contracting a communicable disease? Because we know like the risk of, getting a tick infection or like a tick bite or something if we're playing out in the woods or, whatever. But what about all of the other communicable diseases? Like what's our actual risk? We're in Jefferson County in the middle of the Midwest. Do we have a risk? I mean, we do.
Yeah.
That was the simple answer. Yes.
Yeah. Yes. I mean, defining your risk is dependent upon so many factors, but yes, we are all, I mean, we have the tick-borne illnesses, we have the respiratory illnesses, we have the GI illnesses. I mean, these little vectors, bacteria, viruses, whatever it be that are making us ill are everywhere. And
Right.
you know, the other thing is a lot of people in our community travel. Global travel directly correlates with what we see in our community. So when you go somewhere, you're being exposed to whatever's circulating in their community.
Right.
And I'm not saying don't travel. Like, I'm not saying that at all. Just know that plays a role in what we're seeing. I mean, and the best thing you can do is educate yourself and practice prevention, the good hand hygiene, vaccinations if they're available, cooking food thoroughly, checking yourself for ticks, staying on top of your health if you feel sick, and going to the provider before it gets to where you can't walk.
Yeah, I was actually just going to ask that because obviously we know with COVID, and now we have a COVID vaccine. So are there vaccinations and things that people should be looking at? Because I know when people do like international travel and things like that, a lot of the education and messaging that we push out during the summer is if you're doing international travel, check to see what vaccines you need. Like, figure out where you're going, see if there's, recommended vaccines, make sure you're up to date on them. What kind of, I mean, obviously we have the COVID vaccine, but what kind of recommended vaccines do you suggest people take a look at before they travel?
I think that's really dependent upon where they're traveling. I don't think that's a straightforward answer necessarily. But things like pertussis, that's a communicable disease. That can be anywhere, and that there's a vaccine for that, and you can make sure that you're on top of that. But as far as traveling vaccines, Tara, do you have anything that you want to add?
The CDC has a site too where you can put where you're going, and they'll let you know what you need to be up to date on. So if you go to cdc.gov and then you put in travel vaccines or something like that, it'll pull that up. It'll also let you know what else is going on within that country too that might not be vaccine preventable, but for your knowledge.
Yeah, I can definitely, I'll link that here too. That way if folks are interested in just kind of seeing what we have there. So with COVID and communicable disease and case investigation and epidemiology kind of being brought to the limelight, so to speak, there's a lot of confusion that's out there sometimes. And like going through messages that we get or comments on social media and things, there tends to kind of be trends on maybe some misinformation or confusions. And one of them was the difference between chronic disease and infectious disease. So I think that one's a vital one, especially because we've been providing like real-time data for our COVID cases because we are in the middle of a pandemic, and that is an infectious disease. So we look at data a little differently versus like a chronic disease like heart attacks. We've had people that are like, well, how many heart attacks did we have last week? It's a little different. So being able to try to explain that the difference between chronic and infectious disease and how we pull that data.
Yeah, so the reports that we receive, as Vanessa was saying earlier, they pertain to diseases that are on the list of reportable conditions. So cancer, heart attacks, obesity, stuff like that, that's not on that list. There's definitely other entities out there who track data like that. It's just that those aren't communicable diseases, so it doesn't fall in our wheelhouse. Infectious diseases, they're actually caused by a particular disease-causing agent, or a pathogen is what we call it. So like a bacteria, a virus, a fungus, anything along those lines. And it's transmissible from person to person or through a vector of some sort. And then chronic diseases like our heart disease, diabetes, cancer, they can all have a root cause that's linked to other comorbidities or health conditions, your genetics, certain environmental factors, but they're not contagious and they can't be passed from person to person the same way that the infectious diseases are passed.
Great. And there's definitely places, I know like obviously the CDC compiles that data, but even like the state of Missouri, if you go to the Missouri DHSS website, you can pull that data. Now, it's not as up to date as last week, like, it's like you would see with the COVID tracker and things like that. But that data is there. So, and we use that a lot at the health department to kind of drive what programs that we're working on or education messages that we need to push out based on like what we're seeing, incident levels of and things like that. So it's just a different way of collecting it. But that one is very confusing for folks because infectious and chronic are two very different types and two very different types of data. One of the other confusions that we get, and I have to admit, I was kind of one of these people a while back before I started in public health, is the difference between endemic, epidemic, and pandemic, because we're all familiar with the word pandemic. And we've heard the word epidemic with like when people say like the obesity epidemic or the opioid epidemic. But truly, what is the definition from the professionals here? What are the definitions of those?
Yeah, so we're very familiar with the word pandemic, but not everything is that severe. Not everything is an outbreak, but we do have conditions that continuously circulate in our community, and that's what we call endemic levels of illness. So it's a constant or usual level of disease in the area. That's endemic. An epidemic, it often refers to cases, an increase in cases above what that normal level is. And then a pandemic refers to an epidemic that has spread over several countries or affects a very large number of people.
Okay. So there's that difference there between epidemic and pandemic, because I think my grandma at one point was asking me and I was like, I really should know the answer to this, but I didn't know the answer to that one. So kind of like looping back to what we were talking about before with the summer safety, so to speak, for communicable disease, because I never would have really thought of those two things together, but making sure that we reiterate ticks and summer barbecues and foodborne illness, like use those prevention steps. The bug spray, the checking for ticks, making sure you sneak a meat thermometer over to the neighbor's barbecue. There's nothing wrong with bringing a meat thermometer to your mother-in-law's barbecue to double check. Sorry, Teresa. So just kind of making sure we have those tips in our back pocket. And we're going to be posting a bunch of stuff like in the next couple of weeks that kind of have graphics and stuff that'll help remember, and also how to remove a tick, because that's also super fun too. The CDC was very helpful when I got back from our property one night, and I was like, man, now I have to figure out how to do this. Google how to remove a tick, and there's the CDC. So that's helpful. Let's see if we have any questions in the comments. I'm going to take a look at that. While we're doing that, is there anything else that anybody wanted to add about like communicable disease or epidemiology that we haven't talked about? We hit a lot of topics. No, they're like, nope, we're good. We've got it. Let's see. I don't see any questions. So that's actually exciting. We must have done a great job by covering all this information, and we don't have to worry about answering those questions. Well, if you guys do have questions about CD or epidemiology, you can always reach out. You can put them down in the comment stream if you watch this video later, and I'll get back to you with an answer. And if I don't know it, I will bug one of these lovely ladies via email, get the answer, and get back to you on that one. So since we don't have any comments or questions, we're kind of we got about a little bit left of our time. We'll go ahead and close out this segment. It'll be a shorter episode, but that's okay. Thank you, Sara, Tara, and Vanessa for joining me and discussing a critical topic that kind of hides out in the background, but is often misunderstood. Our next episode of JeffCo Health Matters is going to be on June 30th, and we're actually going to be talking to one of our community health program leaders. We're partnering with the Fox C6 school district on one of their programs. So we're actually really excited to chat about that one. They've been working on this one for a while. So if you have a kiddo in Fox C6 school district, you're definitely going to want to tune in for sure. If you have any suggestions on future topics for a segment of JeffCo Health Matters, or if you just want to learn more about some of our other programs, you can leave that information in the comments, or you can always email us at communications@jeffcohealth.org. That's it, ladies. Thank you so much for joining me, and everyone have a good evening.
Bye.